Hi everyone, I am Dr. Rekha Prashanth. Today let us understand what is endometriosis. Did you know 6 to 10% of Indian women population are suffering with endometriosis? So what is endometriosis? It is the endometrial glands or the stroma present outside the uterine cavity, maybe it be in the tubes, in the ovaries, pelvic cavity or abdominal cavity. It is a chronic inflammatory disease, mainly estrogen dependent. It can occur at any age of life in women, but the most important, which we are going to talk about today, is adolescent endometriosis. Now, let us understand more about adolescent endometriosis. Adolescent endometriosis occurs in 5 to 10% of patients with endometriosis. Usually, adolescent girls come with chronic pelvic pain. 25 to 70% of these patients coming with this pelvic pain are suffering with endometriosis. They also present with atypical symptoms and the pain may be ignored, and hence the delay in diagnosing endometriosis. So when you come across a girl in your family with regular school absentees, with a family history of endometriosis or a neonatal uterine bleeding, then these are the symptoms or the risk factors which you need to consider that this girl might develop endometriosis in future, and of course will affect the outcome of fertility later in life. Mainly the neonatal uterine bleeding, the chronic pelvic pain. This pain, what we call it as dysmenorrhea, is usually dull aching. It can be a throbbing pain or it can be a sharp shooting pain. It can also increase physical activity. If not diagnosed early, this symptoms can progress the disease and affect the future fertility and the quality of the life. The overall endometriotic patients, 2% of these patients are asymptomatic, 10% are in the reproductive age group, 30% patients suffer with subfertility, and 50 to 60% of these patients come with chronic pelvic pain. And what are the important risk factors which is affecting this endometriosis? Mainly the history of neonatal uterine bleeding, then early age menarche, that is less than 12 years, then they have severe pain, they also come with polymenorrhea, that is frequent cycles. They also have menorrhagia, that means excessive uterine bleeding during cycles. The risk factors are history of neonatal uterine bleeding, early age menarche, that is less than 12 years, polymenorrhea, frequent cycles, menorrhagia, wherein they have excessive bleeding during their menstrual period. The newer risk factors which have been observed recently are mothers suffering during their pregnancy with preeclampsia, with post-maturity, IUGR, and RH incompatibility. So when we look into all these, there are challenges in diagnosing endometriosis, especially in this adolescent age, wherein the pain is being ignored both by the family members and the patient, and also the primary dysmenorrhea, which is common even in other conditions. The bimanual examination is not recommended. Then other imaging investigations are though sensitive, it can be delayed. The diagnostic laparoscopy, and this delay in diagnosing can go up to 6 to 10 years and hence can affect the quality of life and future fertility of this patient. The clinical symptoms which these girls usually present with are dysmenorrhea, progressive dysmenorrhea what we call, and not responding to both the painkillers or the NSAIDs and the contraceptive pills. They also suffer with atypical pain which can be both cyclical or acyclical. With progression, it can become acyclical and the pain can come at any point of time. They also suffer with menorrhagia, irregular bleeding, gastrointestinal symptoms like loose motions and vomiting, and also genitourinary symptoms like dysuria. So the diagnosis in these patients is mainly by rectal examination. Then we have CA-125, a blood test. We also have ultrasonography, MRI studies, and the gold standard is the diagnostic laparoscopy. So our aim or the goals of the treatment should be in giving this girl a pain-free periods, and also to prevent the progression of this disease, and of course to give her a future good fertility outcome. The management of endometriosis in adolescent girls is both medical and surgical. In medical management, Though we are restricted with fewer drugs for these adolescent girls, but still we have non-steroidal anti-inflammatory drugs and the combined oral contraceptive pills. And these pills, when given for a period of 3 months, are very effective in these adolescent girls. But the fear in the family members should go away that by giving these contraceptive pills, the girls are going to have future any side effects. It in fact is a wonder drug for these patients because they become symptom free. We also have newer drugs like Dinogest, then Danazol, GnRH agonist, which all these drugs should be given by your concerned doctor, and no drugs should be given for a longer period without consultation, as these can cause long-term side effects. We also have some intrauterine devices, but of course it is not possible to give these in these adolescent girls. Of course, the surgical management is diagnostic laparoscopy, the gold standard treatment for endometriosis. It can be both diagnostic and can also be the treatment for these severe endometriotic cases. Hence, diagnosing adolescent endometriosis in these girls is very challenging and very important, as we can prevent the both physical and mental agony of these girls, and of course help them in their future fertility outcomes. Thank you for watching this video, and in my next video we will talk about endometriosis at other age groups.